Hi, everyone. Welcome to Bringing Virtual Care Home. My name is Tina Null. I'm the Chief Clinical Officer at Anelto, and my guest today is Laura Black, who is the President of Virtual Care for ChenMed. And Laura, welcome to the show.
Thank you so much for having me.
My pleasure. So, Laura, why don't you tell the audience a little bit about your role at ChenMed? My understanding is that the virtual care arm of ChenMed is referred to as IntuneHealth. Is that correct?
Right. So I joined ChenMed about 2 years ago to help design and launch this new brand called IntuneHealth. IntuneHealth is, like the rest of ChenMed, a value-based Medicare Advantage primary care offering. We are targeting a little different senior that is maybe a little more tech savvy and maybe more active. Maybe does a little more traveling, right? One that really is going to take advantage and requires that telehealth offering and some of the other technologies that we have, like a mobile care app.
Well, so tell us why you think it's important for older adults to have preventative primary care through your IntuneHealth virtual care model.
Yeah, there's really two reasons to do preventive care. One is because things, when you're older, they change quickly, right? We want to catch problems really early on. So seeing your doctor when you're feeling well, or maybe something's just getting started, is really advantageous to keeping things under control, not letting anything get out of control, and not going on until it's too late. But the other reason why we do preventative care is really to build that relationship with your PCP, right? If you see your doctor frequently, then you build an actual relationship with that doctor. We've all gone to the doctor and you make that list of questions and then, oh, you forgot that thing that you forgot to mention, right? Well, this doesn't happen here because you're going to be talking to your doctor again in just a few more weeks. And so if you forgot to say something today, you can say it in that next visit. You really build a rapport. We share the doctor's cell phone numbers. You can call them any time of day, night, weekend, and they really are there for you. And we build that relationship so that you are able and willing to share more with a doctor that you know and trust.
Well, great. So it sounds like, based on your description of the older adult that might use the Intune Health suite of products, that they might be using like a mobile app with a bring your own type device. Is that correct?
Right. So we can serve any Medicare Advantage patient that signs up. But if you have a mobile smartphone, you can download our mobile app. And it really is. We're just launching tomorrow an updated version. You have your appointments are in there. You can actually log into your telehealth through the mobile app. Your medications are in there. You can request a refill for your medications. And then you can chat with your care team, really leave a chat 24/7. And that chat can be anything about your health. Maybe you want a copy of a upcoming referral to a specialist or something like that. So it's really exciting. This most recent version is going to have your lab results. So they're going to be loaded up immediately as soon as those labs are available to us. They will be available to the patient, and they'll be right there in the app. You won't have to ask for a copy of your labs or make any kind of inquiry. Those are going to be automatically uploaded. It's really exciting, and I think that older adults that are used to using mobile apps will really enjoy working with their care team through mobile app.
So it sounds like one of the most complicated things when you say somebody needs to be tech savvy is that they know how to download an app, and oftentimes they need to know their password kind of thing. So sounds very doable. So do you at Anelto, we do remote patient monitoring. So we're able to connect with the patient through a two-way communication channel where they can transmit vital signs or be asked symptom and well-being questions. Are you doing any of that type of care through the Intune Health?
At the moment, remote patient monitoring is definitely on our roadmap. We see that as a future chapter, really leaning in on getting that integrated technology. Most of what we would do on the mobile app would be a self-reported. It's not integrated devices. We do give our patients devices, a blood pressure cuff, a scale, those kinds of things, so that we can ask them, it's time to weigh yourself today. Could you please go weigh yourself and then self-report that weight? So definitely some opportunity there to integrate and automate aspects of that part of the offering. One of the other unique features of Intune is that we have something called a mobile care champion. These are community paramedics that go into the home and actually can take vitals, and that's not through the app, but they use the technology that we actually have here in the center. So they're able to enter vitals for patients that are in their homes, even help the patient access a visit with their doctor, right? So they do a lot of extra just beyond the medical care to help the patient with technology. So lots of ways we're trying to integrate getting those real-time measurements when you're in the convenience of your home.
Oh, that is wonderful. So, is your company available to seniors across the nation, or is it concentrated in a particular geographic location?
Yeah, we launched in 2022 with two centers in Florida. So we have one in Broward County and one in Fort Myers. And so we are really new, really young, just proving it out, really hoping, value-based care has been historically targeting some of the most needy neighborhoods, those medical deserts, right? The primary care deserts. And we're really trying to see if there is an opportunity to bring value based care to middle income seniors, right? This is a category, middle income Americans are some of the most likely to go bankrupt because of medical bills and expenses. We do think that preventative care, value based care is right really uniquely designed for this category. They just haven't had access to this kind of care, and they have some greater demands. So we're trying to design something that meets the expectations of convenience and accessibility that this demographic will need. So we're going to prove that out on these two centers, and then hopefully you'll see us nationwide in the coming years.
Wow. Value-based care typically is a strategy to reduce overall cost of care. Can you tell me some of the wins that IntuneHealth has achieved through your product to date?
Yeah. So we have a wide variety of risk categories for our patients. Some of them are very complex and some of them not so much. One particular complex patient had advanced congestive heart failure, lots of edema. We actually saw him every single day, whether he came into the center or we sent the paramedic to his house. We were seeing him every day, trying to get him adherent to his medication, get him stable. He is now up and walking around with his walker again. He is able to go out and do visits. So we really think that this ability to see a patient as often as is needed and have the doctor really the primary care physician in a value-based care office like ours is really elevated to really use the full spectrum of his or her license, right? Our doctors are performing biopsies right here in the office. They're doing pain injections right here in the office. We don't have to send our patients to specialists for all of those different procedures. It makes it convenient. It makes it fast. And you trust your doctor after you've built this relationship. So it's really something you're quite comfortable for the patient. So we have a lot of success stories like our patient with CHF who's gotten, up in an ambulatory, right after, with his treatment. So we're really excited about that and the possibilities that we can make everybody healthier.
Well, you know what? I love hearing that. And I talked about how value-based care reduces overall costs, but we all know that the other thing that it does is improve quality of life for large patient populations, which is exactly what you described with your CHF patient. So good for you. And I think about these seniors that are handed a diagnosis late in their life with little tools or knowledge about how to kind of slow the progress or stay stable in that state, and have lived a lifestyle that in a lot of ways has contributed to that condition. So to open the lines of communication and help coach that person towards a lifestyle or some minor modifications in their lifestyle to stay stable is just wonderful. So thank you for that. Who else besides physicians do you have participating in this virtual care?
Right. So we have a full array of specialists that we call upon to do e-consults across just about any specialty you can imagine. So we can get within 24 hours an opinion from one of our internal specialists really just about any condition. And so the patient doesn't have to wait months to go in to see a specialist. Even we have patients who of course come to us with already established relationship, and we can get a second opinion for them. We can really speed things along, make it more, as you say, more cost effective, make it more, easily accessible. So that's really an exciting part of the offering. We also have, you talked about health coaching. We actually have a health coach on staff. We're really trying to design, value-based care providers like ourselves. We talk about preventative care, but we really don't lean in very heavily on like how to help people eat better and how do people exercise more. We host a yoga class. We hope they come once a month, but that's not really going to keep people on their care plan, month to month, quarter to quarter. So we have a health coach who is really teaching people how to set smart goals, how to stay connected to those goals. She's working through our mobile app, communicating with people on, trying to keep them motivated to follow their diets and meet those goals. So it's really exciting. So we're completely designing this from scratch. So new for all of us to design this health coaching program for our patients as well.
That's wonderful. Do you employ nurses and social workers or other disciplines beyond the health coach and the physician?
So we don't have any nurses on staff immediately. We do have some after hours nurse triage that we use so that we can always provide good guidance to our patients. That's a ChenMed staff that we rely on and integrate with. So, but right now we're a PCP-led care team, and we have our community paramedics, but no nurses on staff at the moment.
Wonderful. Okay, thank you. So what's next for ChenMed or in particular IntuneHealth that you're really excited about?
Yeah, well, for us, it is really just the growth model, right? We were really proud of what we're designing here, and I can't wait to bring it to more and more Americans. But we really just want to prove out not only we've already gotten a lot of great feedback. People love the service, and they love the opportunity to come in here, meet their doc, get to know their doc, and we're right here in these communities. So really exciting feedback here early on that the demographic that we're targeting is really interested in this product and willing to come here. But then the second thing we have to prove is that we can actually keep them healthy. We're going to keep them healthy and happy at home, keep them out of the hospital, keep their chronic conditions, well managed. So we need a little bit of time to prove that we can both wow them with a great patient experience and then also keep them healthy. So I could imagine us working with these two centers, just growing in these two centers for the next several months and getting those proof points. And then hopefully you'll see the future for us is really a growth model.
Yeah. So what is the biggest challenge you've overcome so far to implement your model?
Yeah, I would say that many of the people in our demographic, the older adults, are on original Medicare, maybe original Medicare with a supplement. They're not familiar at all with Medicare Advantage, and so really understanding that we're not doing all these tests to charge more to Medicare. That's not what's happening here. We're actually, doing that because we think that's what's in the best interest of the patient. So explaining the model, it's really complicated. It really is. I have older parents myself, and I try to explain it every so often, and they're like, yeah, they're not in my market, so I don't have to make them be patients. But yeah, no, they're like, wait, I don't think that's for us, and maybe it's not. But I'd like to think that this is really a model that anybody would appreciate if they really understood it. So it's really just getting that message out, making sure that the demographic that we're targeting is really understanding what we have to offer. We know that as soon as they walk in the door, they experience this. We have some great feedback, great NPS scores. So we know that they love it once they're here. But getting them to come in and try it out is the biggest challenge.
Yeah. Yeah. Well, so before we close, is there anything else that you want the audience to know about ChenMed or Intune Health, so that they can contact you if they're interested?
Absolutely. Well, you can reach us at IntuneHealth.com. So please go and check us out, get some more information, leave us a message. We are happy to share our story with anyone who is interested. We are partnering with health plans, with brokers, and of course, trying to reach as many patients as we can save as possible. So love to talk about any of those opportunities with the audience.
Great. Well, Laura, thank you again for your time today. And I hope we can connect in the future. And if there's anything about remote patient monitoring that
We'll
Anelto
be
can help
calling.
with, would love to talk some more. For those of you out there, I hope you'll join us again soon for another episode of Bringing Virtual Care Home. And in the meantime, have a great day.